Welcome back. Today we'll study one more important topic, that is the blood supply of the upper limb. Blood supply of the upper limb. So these are the specific objectives. State the origin, the course, and main branches of the major arteries of the upper extremity, that is the upper limb, which includes the axillary, brachial, radial, as well as the ulnar arteries. Mention the beginning and termination of main veins of the upper extremity and list their tributaries. Then identify the clinical importance for the superficial veins of the upper extremity, how they are clinically important, and mention the surface anatomy of the great arteries of the upper limb, which includes the brachial and the radial artery. So these are some of the specific objectives which we'll cover in this lecture. So to begin with, we'll start from the subclavian artery. As we know, the subclavian artery is one of the branches from we have studied the arch of the aorta in the previous lecture, the different parts of the aorta. So one of the artery coming, the three branches coming from the arch of aorta. One is the brachiocephalic trunk. Then we have the left subclavian as well as the common carotid. So these are the left common carotid as well as the left subclavian. These are the three arteries coming out. Okay, so one of the branches coming from the arch of aorta is the subclavian artery, but this is the left subclavian. The right subclavian will start from the brachiocephalic trunk. This is the brachiocephalic trunk. From there it divides into two branches, that is the right subclavian as well as the right common carotid. So left common carotid as well as left subclavian directly come from the arch of aorta, but for the right, it starts as a single artery, brachiocephalic trunk, and then divides into right subclavian as well as the common carotid. Okay, so the subclavian artery is a very important artery. Why it is important? Because it is the main artery of the upper limb. So this is the main artery which is supplying the upper limb. So if there is any damage to this artery or block or thrombosis, embolism, anything, then it can lead to the total loss of blood supply to the upper limb. So this is a very important artery, main artery supplying the upper limb, but also supplies a considerable part of the neck and brain. Okay, this also supplies the some parts of the neck and one of the major arteries which is supplying the brain. Okay, it is not so only supplying the upper limb but also the brain as well as some part of the neck. So this artery becomes a very important artery, the subclavian artery. Okay, the area supplied by it extends as far as to the forebrain, that is the front of the brain. There are the forebrain, midbrain, and the hindbrain. Brain is divided into three parts. The forebrain, which is the anterior part of the brain, that is called as the forebrain. It supplies the forebrain, then it extends up to the abdominal wall. Okay, then it will supply the upper limb up to the fingers. Up to the fingers means the whole of the upper limb. So this is the extent. It extends from the brain up to the abdominal wall as well as the fingers. So this is the extension of this blood supply by this artery. So the origin, as I said before, on the right side it arises from the brachiocephalic trunk. So this is the artery. The brachiocephalic trunk is one of the major artery from the arch of the aorta. So this right subclavian arises from the brachiocephalic trunk. Okay, so this is the right subclavian artery. And on the left side, from the arch of the directly from the arch of it. On the left side, we have seen that it is a direct branch from the arch of the aorta. So it is very close to the after the major artery, the aorta. So this is one of the very important artery close to the aorta itself. So left subclavian, direct branch from the arch of aorta. On the right side, it is initially begins as the subclavian artery, then continues as the right subclavian artery. Okay. So this is the difference between the right subclavian and the left subclavian. Left subclavian directly from the arch of aorta, right subclavian from the brachiocephalic trunk. So this can be traced posterior to the sternoclavicular joint. It can be traced. This is the artery here. This is the brachiocephalic trunk, and from there you can see this is the subclavian artery. If you want to trace this artery, here is the whole course. So for the left side, it is directly from the arch of aorta, and this is the whole subclavian artery. Okay, so this can be traced posterior to the sternoclavicular joint. Sternum as well as the clavicle will be present here. It is not shown here, so it will be just behind, so that you can appreciate the artery. So in the front there, it is covered by the sternum as well as the clavicle, the junction between the two. That is called as the sternoclavicular joint. Extent, it arches from this sternoclavicular joint to the outer border of the first rib. As you can see here, it is arching from sternoclavicular joint and it goes up to the first. This is the first rib cut here. So this is the first rib. It goes to up to the outer border of the first rib. So here also you can see here, going all the way up to the. This is the first rib here. It is going on. Here beside that is the subclavian vein. This is the subclavian artery. So it arches from the, as you can see here, the arching of the artery on either side, arches from the sternoclavicular joint to the outer border of the first rib and continues further as the axillary artery. Beyond this first rib, outer border of the first rib, this is the inner border of the first rib and this is the outer border of the first rib. Beyond that outer border of the first rib, it continues as the axillary artery. So axillary artery is nothing but the continuation of the subclavian artery. Now coming to the course of this artery, it is divided by the scalenus anterior muscle. If you see here, there is a muscle called as this scalenus anterior muscle, which will divide this artery into three parts. Okay, the first part is medial part. Whatever part is medial to this muscle, this is called as the first part. Here also you can see the muscle. Beside that, whatever medial part is there, that is called as the first part. The part which is posterior to this muscle, that is called as the second part. Okay, then there is a third part which is lateral to this muscle called as the scalenus anterior. So whatever part is lateral to that, up to the border, the outer border of the first rib, this whole part is called as third part of the subclavian artery. So it has three parts: medial part, posterior part, and the lateral part. First part, second part, and the third part, which is in relation to the scalenus anterior muscle. Why it is divided into so many parts? Because it gives many branches, so that if you divide it into parts, then you can easily identify the branches. So starting from the first part is the other part which is medial to this muscle. Okay, scalenus anterior. So what are the branches coming from the first part? One of the very important artery is this artery here, which is passing through the vertebrae. Okay, this is called as vertebral artery. So these are the cervical vertebrae. They have a transverse foramen here within the transverse process, and this artery will pass through this transverse foramen of the cervical vertebra. That's why it is called as the vertebral artery, because it is passing through the vertebrae. So that's why it is called as vertebral artery. This is a very important artery because this is one of the two arteries which will be supplying the brain. Only two arteries will be primarily will supplying the brain. So this is one of the two arteries. So very important artery which is supplying the brain. You can see here on either side. This is the vertebral artery. The second artery coming from the first part is the internal thoracic artery. Very important artery again is the internal thoracic artery, which is supplying the thorax, the mammary gland, the pectoral region, everything. Okay, so this is called as the internal thoracic artery. Here also you can see here the internal thoracic artery. Then we have a branch artery called as the thyrocervical trunk. The third artery here, this is called as the thyrocervical trunk. This is the artery here, which will be giving three branches. As soon as it comes, it will be giving three important branches. One is the inferior thyroid artery. One of the branches is the inferior thyroid artery, which is supplying the thyroid. As the name indicates, it will be supplying the thyroid gland. So this is called as the inferior thyroid artery. The second artery will be suprascapular. Second artery will be the suprascapular. If you see here, they have shown here. This is the suprascapular artery. Here also you can see here with the suprascapular artery. The third artery is the transverse cervical artery. Transverse cervical artery. So these are the three branches coming from one artery called as the thyrocervical trunk. This is thyrocervical trunk. This is the artery which gives three branches: inferior thyroid, suprascapular, as well as the transverse cervical artery. So these are the branches from the first part. Okay, first artery is the vertebral artery, second is the intrathoracic artery, the third artery is the thyrocervical trunk, which will give three branches: inferior thyroid, suprascapular, as well as the transverse cervical. Now going to the second part. Second part is which part? Which is behind this muscle. That is the second part. Okay. What arteries it will be giving? This will be giving a important artery called as the costocervical trunk. Costocervical. If you see here, so here the muscle has been removed so that you can appreciate the artery. Here the muscle is there, so you cannot see because it is posterior. So here the muscle has been removed so that you can appreciate the artery. That is the costocervical trunk. Costocervical trunk. This, as soon as it comes out from the subclavian artery, it will give two branches. One is called as the superior intercostal artery, or it is also called as the supreme because it is the highest, the first artery, which is supplying the intercostal space. So that's what is called as the supreme, or it is also called a superior intercostal artery. And the second artery is called as the deep cervical artery. These are the two branches coming from the costocervical trunk. Okay, all these arteries are very important because they will be supplying very important branches in the neck and the chest and other parts. Okay. The third part is which is lateral. This is the lateral part, which is third part, which will be giving the dorsal scapular artery. Dorsal scapular artery. I think this branch has not been shown here. So this third part will be giving only one branch called as the dorsal scapular artery. So the first part will be giving three branches, second part one branch, then the third part one branch. Okay. So these are the five important arteries which are coming from the first, second, and third part of the subclavian artery. Now studying these arteries, because these arteries, as I said, are very important, so we'll study some details about these arteries. The first artery, which I said is the most important, is the vertebral artery. Why it is most important? Because, as I said, it is one of the only two arteries which are supplying the brain. So if there is any deficiency of blood supply through these arteries, then it can lead to a lot of damage to the brain, because brain is very sensitive for oxygenation. So even slight decrease in oxygen supply will lead to lot of damage within the brain. Okay. So vertebral artery is this artery which is passing through the vertebra. It arises from the upper surface of the first part of the subclavian artery, as we already seen from here. So on either side, it is one of the main arteries which supply the brain. As I said, it is one of the two arteries. It consists of four parts. It is divided into four parts. Okay, so there will be first part, second part, third part, and the fourth part. First part is that part which is from the beginning up to the entry of the into the transverse process. Second part is within the transverse process. Then third part is in the lower part of the neck, and fourth part will enter the brain cavity. So now coming to the branches which are coming from these vertebral artery. In the neck, it will be giving some branches which are called as the spinal branches as well as the muscular branches. So when it comes into the neck, it will be giving some branches which are supplying the adjacent. It is not shown here. Okay, anyhow, so it will be giving some branches which are called as the spinal branches as well as the muscular branches when it is passing through the neck. Okay, in the cranial cavity, once it enters the cranial cavity, that is inside the near the brain, so then it will be giving very important branches. One of the, if you see here, this is the same artery here. So this is the subclavian artery. This is giving the right vertebral, and this is the left vertebral. So both are going there in the neck. This is the neck part. Then in the lower part of the neck, and this is the entry into the brain. Okay. So when it is once enters the cranial cavity, it will begin some important branches. One are the meningeal branches, which will be supplying the meninges. This is the same artery here, subclavian artery, giving this is the vertebral artery passing through the vertebrae. Once it enters the neck, then it will be giving some meningeal branches, which are coming supplying the meninges, which are covering the spinal cord and the brain. Then it will be giving two important branches called as the posterior and anterior spinal arteries. So if you see here, so it is giving, when it comes here, it is giving the branches. One is called as the posterior spinal artery on either side. posterior, okay, which is going posteriorly, and then it gives the anterior spinal arteries, right and left anterior spinal arteries, which join together in the midline to form the anterior spinal artery. So initially it will be branches right and left, then they join together to form the anterior spinal artery. So it will be giving the anterior spinal artery as well as two posterior spinal arteries. Okay, so meningeal arteries, branches, posterior spinal artery, anterior spinal artery, as well as the posterior inferior cerebellar artery, the largest among this. This is the posterior, this is the basilar artery. Both these vertebral arteries join together to form the basilar artery. If you see here further, as soon as they give the branches, anterior and posterior branches, then it joins together to form the basilar artery. Okay, then here it will be given one branch, which is the largest branch and a very important branch called as the posterior inferior cerebellar artery. So as the name indicates, it is supplying the cerebellum, the small brain, cerebellum. Okay, not the cerebrum, it is supplying the cerebellum. Okay, so these are some of the important branches from the vertebral artery. One is the meningeal branches, posterior spinal artery, anterior spinal artery, posterior inferior cerebellar artery. Among this is the largest artery. Then it will be also giving some many territorial distributions, branches. So we'll not go into detail about that. Now going to the next artery, that is called as the internal thoracic artery. Internal thoracic artery, or it is also called as the internal mammary artery, because it will be supplying the mammaries, the breast, okay, as well as the pectoral region. So on either side they are there. So that will be studied more in detail when we study the mammary gland as well as the chest wall. The third artery is the thyrocervical trunk. Thyrocervical trunk, as we have seen. So this is the thyrocervical trunk. So here is the thyrocervical trunk. So here you can see. So it will be giving three branches as we saw before. One is the inferior thyroid artery, then the which is supplying the thyroid, then the superficial cervical, as well as the suprascapular. Suprascapular will be going and supplying the scapular region. We'll study about that. Then we saw the third artery is the costo-cervical artery, which will be giving two branches. One is the deep cervical artery, and then the superior intercostal or the supreme intercostal artery. Then we have the third part of the subclavian artery, which will be giving the dorsal scapular artery. So these are some of the branches which are coming from the subclavian artery. Now going further, the blood supply of the upper limb. Before we study the blood supply of the upper limb, we should know the anastomosis around the scapula. See, the scapula is also a part of the upper limb, which form part of the shoulder girdle. So this scapula has a very big network of blood vessels which anastomose. Anastomose means join together, connect to each other. Okay, it occurs at two different points. One is the anastomosis around the scapula. So here you can see so many arteries around the scapula, as well as anastomosis over the acromion process of the scapula. This is called as the acromion process, a very important process which articulates with the clavicle. That is called as the acromioclavicular joint. So this region is also supplied by very important arteries. So the whole of the scapula in one, and the second is the anastomosis around the acromion process. Coming to the anastomosis around the body of the scapula. Okay, so here this is how it looks like. Lot of blood vessels around the scapula. Here again it occurs at three fossae. As we know, the scapula has three fossa. One is called as the subscapula, which is behind, and then we have the supraspinatus fossa and infraspinatus. This is the spine. So whatever region above that, it is called as the supraspinatus. Whatever is below that is called as the infraspinatus fossa or the infraspinous fossa. Okay, so this anastomosis occurs at all these three fossae. Okay, it is formed by three arteries, namely one is the suprascapular artery. One is the suprascapular artery here. Okay, so here is the suprascapular artery, which is a branch from the thyrocervical trunk. Already we have seen that is the suprascapular artery. Then we have the deep branches of the transverse cervical artery. So there is also the transverse cervical artery, which is also a branch on the thyrocervical trunk. That is giving branches here, which gives a branch called as the deep branch of the transverse. This is a transverse cervical artery. So this will be giving a branch called as deep branch, which will anastomose around the scapula. Then we have the circumflex scapular artery, which we have not studied till now, but you should know this is one of the branches from the axillary artery. Here are the circumflex, anterior and posterior circumflex, which are around the neck of the humerus. Around the neck of the humerus, there is a very important artery, anastomosis, that is called as the circumflex artery. It is anterior and posterior. There are two arteries actually. So these are the anastomosis around the scapula. These three arteries will form the anastomosis. One is the deep scapular artery, the suprascapular artery, which will be giving multiple branches. Then the transverse cervical artery, which will be giving a deep branch. Then the circumflex scapular artery, which will be not only around the uh, the here are the circumflex arteries, which will be giving a lot of branches here. Okay, so circumflex scapular artery, which will be around the scapula. Okay, so these arteries will be anastomosing around the scapula. Then coming to the anastomosis around the acromion process. How this anastomosis at the acromion process will be formed? It is formed by again three branches, acromion branch also of the thoracoacromial artery. If you see here again, this is the thoracoacromial artery, which is giving one branch called as the acromial branch of the thoracoacromial artery. Then the acromial branch of the suprascapular artery. The suprascapular, we have already seen this, the suprascapular artery. It gives one branch, which is the acromial branch. Then the acromial branches of the posterior circumflex humeral artery. So here is the posterior circumflex humeral artery, which will be giving a branch. This posterior circumflex humeral artery is around the humerus, and the posterior the circumflex scapular artery is around the scapula. So here is the circumflex scapular artery, and this is the circumflex humeral artery. There is a difference between the scapular artery and the what we studied here is the circumflex scapular artery, which is supplying the scapula. Then here what we have is which is around the neck of the humerus, that is the posterior circumflex humeral artery, which is giving the acromial branch. So these three branches coming from the thoracoacromial artery, then we have the suprascapular artery, which is giving an acromial branch, as well as the posterior circumflex, which is giving the acromial branch. All these three arteries come in anastomosis. This anastomosis is very important because this is the anastomosis between the first part of the subclavian artery. Okay, subclavian first part of the subclavian artery giving the both the what we call as the suprascapular artery, as well as the thoracoacromial artery, and these will anastomosis with the third part of the axillary artery. Just like the subclavian artery is divided into first, second, and third part, medial, posterior, and lateral part. Similarly, we will see later that even the axillary artery, which is the continuation of the subclavian artery, is also having three parts. So this branch, the posterior circumflex, will be a branch from the third part of the axillary artery. So there is anastomosis between the first part of the subclavian artery and the third part of the axillary artery. So this anastomosis is very important because if there is any clot, block, embolism, something like that, still there will be, because of this anastomosis, there will be blood supply. So that's why this anastomosis is very important. Okay. So this is the anastomosis between the first part of the subclavian artery and third part of the axillary artery. And whenever an arterial block is seen between these 2 points, collateral circulation will be established. So then at that time, this collateral anastomosis become thicker and become prominent. So here again, you can see here, these are the first part, second part, and the third part, okay, of the axillary artery, and before that will be subclavian artery. Here is the first part, second part, and the third part of the subclavian artery here. This is the scalens anterior muscle. So this is the first part, second part, and third part of the subclavian artery. And here is the what is shown in the first part, second part, and third part of the axillary artery. Axillary artery is nothing but the continuation of the subclavian artery beyond the lateral border of the first strip. So up to the first strip is the subclavian artery, then it continues as the axillary artery. Okay, and here is the anastomosis around the scapula as well as in near the acromion process. You can see here the acromial branches of the thoracoacromial artery, then the suprascapular artery giving the acromial branches, and the circumflex humeral artery giving the acromial branch near the acromion process. Then the anastomosis around the scapula itself. So here is a deep artery. So this is a deep cervical artery which is giving the multiple branches. Okay. So this is the anastomosis around the scapula as well as the around the acromion process. Again, these are pictures showing again the same arteries here. Okay. So anastomosis of all these arteries are being shown. Now coming to the contents of the axilla. Contents of the axilla. What is axilla? Axilla is nothing but a pyramidal shaped region just below the shoulder joint between the upper limb and the pectoral region. Between the upper limb and the pectoral region and just below the shoulder joint, there is a diamond shape or pyramidal shape region that is called as the axilla. Axilla. Okay, so here you can see here, this is the axilla. So it is also called as the armpit. Armpit. Okay, so this armpit or the axilla. So what are the contents of the axilla? So the contents of the axilla are, one is the axillary artery. So we have seen this is the subclavian artery continuing beyond the, the lateral border of the first rib as the the axillary artery. So this is the same subclavian artery continues as the axillary artery. This is the axillary artery, and its branches will be here. Okay. So here is the axillary artery and its branches, which will continue again later by as the brachial artery. We'll study later. Okay, so this is the axillary artery. Then we have the axillary vein. Just beside that, we have the axillary vein, which continues as the subclavian vein. Okay, so this is the axillary. Just beside the axillary artery, the axillary vein and its tributaries. Then we have the cords of the brachial plexus, the nerves which will be the nerves which are coming from the C5 to T1. All this form an anastomosis joined together to form a plexus. Anastomosis in case of the nerves is called as the plexus, and they supply the whole of the upper limb. So here you can see this is the plexus of nerves which are joined together to form the important nerves. So this cords of the brachial plexus and their branches, which are the main nerves, will be all going through this axilla again. Then there will be few groups of axillary group of lymph nodes. As you know, the axillary group of lymph nodes, which will be five number in number, those axillary group of or the pectoral group of lymph nodes, which are anterior axillary, posterior axillary, lateral, medial, apical. All these are the different group of lymph nodes which are present in the axilla. Along with that, there will be also, it is filled with axillary pad of fat as well as the axillary tail of spines of the breast. The breast will extend up to the axilla as the axillary tail of spines. So all these are the contents of the axilla. One of the very important content is the axillary artery as well as the axillary vein. Axillary artery with its branches, axillary vein with its tributaries, then the brachial plexus, axillary group of lymph nodes, the axillary pad of fat as well as the axillary tail of spines. So all are present in the axilla. This is the axilla, and one of the very important content is the axillary artery. Now let's study the axillary artery, because this is the main artery which will be supplying the upper limb. Subclavian artery. Sorry. So the as you have seen, the subclavian artery will be not only supplying the upper limb but also the brain. But the axillary artery, which is the continuation of the subclavian artery, will be supplying the only the upper limb. So this is the main artery supplying the upper limb. That is the axillary artery. This is the axillary artery here. Okay. So it is the continuation, as I said, of the subclavian artery. So here is the subclavian artery, continues as the axillary artery. It extends from the outer border of the first strip. So I said the subclavian artery ends at the first strip, outer border of first strip. Then it continues as the axillary artery. So the beginning of the axillary artery will be from the outer border of the first strip to the lower border of the teres major muscle. There is a muscle here called as the teres major muscle. Okay, so it will continue up to the lower border of the teres major muscle. So this is the lower border of the teres major muscle. Then it continues as the brachial artery. So first is the subclavian artery, then it continues as the axillary artery, then the brachial artery. So this axillary artery extends from the outer border of the first strip to the lower border of the teres major muscle. So from here, outer border of first strip up to the outer border of the teres major. If you can see here, this is the muscle, teres major muscle. Okay. Continues distally as the brachial artery in the arm. As I said, it will continue the brachial artery. Parts, it is divided into three parts by the crossing of the pectoralis minor muscle. Just like here, the scalenus anterior muscle divided the subclavian artery into three parts. Similarly, here this muscle called as the pectoralis minor muscle. There are two muscles actually. There is pectoralis major and minor. But the pectoralis minor muscle will divide this artery into three parts. Similar, same as that of the subclavian artery. This is divided first part, second part, and third part. So the first part will be proximal to this muscle, pectoralis minor. The second part is posterior to this muscle, and the third part is distal to this muscle. Okay, that is the pectoralis minor muscle. Okay, so these are the three parts of the axillary artery. So do you have any questions still here? Any questions? If you have questions, you can ask me or we'll continue further. So this axillary artery will be, as we have seen, it has three parts. So these three parts will give six important branches. The first part will be giving a very important artery called as the superior thoracic artery. The first part here, if you can see here, this is giving a very important artery called as the superior thoracic artery. So this is the first part, and it is giving for one artery, superior thoracic artery. The second part is giving two branches. Okay, as the number indicates, the first part 1, second part 2, third part 3. Okay, this is how we can remember. The second part will be giving two important branches. One is the acromiothoracic artery. Acromiothoracic artery. If you see here, this is the artery called as the acromiothoracic artery, or it is also called as the, here they have mentioned, thoracoacromial artery. Both are same. Okay. So acromiothoracic artery or the thoracoacromial artery, and the third artery or the second artery for the second branch will be the lateral thoracic artery. Lateral thoracic artery, it will be running down here. If you can see here, this is the lateral thoracic artery, which will be again supplying the pectoral region of the thorax, as well as the mammary gland also, the breast. Okay, so this is the lateral thoracic artery as well as the acromiothoracic artery. This is the lateral thoracic, and here is the acromiothoracic. Acromiothoracic will be giving three branches, actually four branches, A, B, C, D. Okay, A stand for acromial branch, P stand for, instead of B, it will be P. Okay, pectoral branch, C will be the clavicular branch, and D will be the deltoid branch. A, P, C, D. They are called as A, P, C, D. Okay. Then we have the third part, which will be giving three important branches. One is the suprascapular artery. This is the suprascapular artery. Okay, here you can see here, this is the suprascapular artery, and then two branches, anterior and posterior circumflex humeral artery. So you can see here, this is the anterior circumflex and the posterior circumflex, which is going around the neck of the humerus. So these are called as the anterior and posterior circumflex humeral artery. Okay, so these are three branches. One is the subscapular artery, then we have the anterior and posterior circumflex humeral artery. So these are some of the branches coming from the third part. So first part, superior thoracic artery. Second part, two branches, acromiothoracic as well as lateral thoracic. And the third part, the subscapular, anterior circumflex as well as the posterior circumflex humeral artery. Now coming to the next branch, continuation of the axillary artery as the brachial artery. Here you can see here this is the brachial artery. Okay, so this is the brachial artery, which is nothing but the continuation of the axillary artery. Origin as the continuation of the axillary artery extends from the lower border of the teres major muscle, as we have seen before. There is a muscle here called as the teres major muscle. So it begins from the lower border of the teres major muscle, okay, to the front of the elbow. So as it goes and it comes up to the elbow here, okay, near the neck of the radius. Cause and relation in the upper part it is related anterior to the median cutaneous nerve of the forearm. So there will be the anterior cutaneous nerve of the forearm. So it is not shown here actually. Okay. So there will be the anterior to the median cutaneous nerve of the forearm. Then in the middle of the arm, it is crossed by the median nerve. So if you see here, this is the median nerve crossing the artery. So it was lateral to the artery. Now it comes and becomes medial to the artery. So the artery has become lateral and the nerve has become medial. Okay. So in the middle, the arm is crossed by the median nerve from the lateral to the medial side, and at the elbow covered by the bicipital groove. And if you see in the lower part, this is the biceps brachii muscle, one of the important muscles of the anterior part of the arm. So here it has the biceps. This is the bicipital aponeurosis. There is a bicipital aponeurosis which has been cut so that you can see the artery. So it will be covering the brachial artery. So this is the whole course of the brachial artery. Okay, so this is the artery here crossed by the median nerve from lateral to the medial side, and in the lower part it is covered by the bicipital aponeurosis. Now coming to the branches, what are the branches which are coming from this artery, brachial artery? One of the very important artery branch coming from the brachial artery is the profunda brachial artery, which is the main artery supplying the whole of the arm. The main artery of the arm. This is called as the profunda brachial artery, which passes through the radial groove. So this is also called as the deep artery of the arm. Then we have the superior ulnar artery. So here you can see here this is the superior ulnar artery. Then we have the inferior ulnar artery. So this is the inferior ulnar artery, this is the superior ulnar artery. Then this also gives a nutrient branch to the humerus. Humeral nutrient artery to the humerus bone. Then it will also give muscular branches, direct muscular branches to all the muscles here in the arm. Then there is the terminal branches. It finally comes into the elbow and divides into two branches called as the radial as well as the ulnar artery. Radial as well as the ulnar artery. Okay. So so further we'll study in the next class. I think this is more than enough for you for today. We'll continue this lecture in the next class also. So the same lecture will be continued with further information beyond this. We'll study the radial artery as well as the ulnar artery. Then the plexus, which is formed in the hand, the superficial and the deep palmar arches in the hand, radial artery arches. Then the veins draining the upper limb as well as the surface anatomy. So this is all we have to cover in this blood supply to the upper limb. So if you have any doubts till here, you can ask me. If you have any doubts, you can ask me. So if you don't have any doubts,